Overhead mobility in the overhead squat and snatch is very important. Why? This movement demands a lot of mobility and in-range strength out of really every joint, especially of the upper body, the shoulder, the thoracic spine. We also have the lower body, but today on the Daily Show, we're going to focus specifically on the lats, the subscap, and the thoracic spine. We have Dr. Haley here helping us out, showing off what I am promised is perfect mobility. We'll find out over the next 15 minutes if that's true or not. So we're going to cover lat length. Each test we're also going to cover with the treatment. So we're going to start with lat length. This is probably the easiest thing to both assess and treat. This is often ignored, particularly in the way we're going to demonstrate it, with the key being that everything we do to both assess and treat lat length should be done with a flexed hip, because that imitates the bottom position of the overhead squat and snatch. Often individuals can show you pretty good shoulder flexion, abduction, external rotation overhead, standing with hips extended, but the moment those hips start to flex, lats become pretension, elbows tend to start to fall forward into extension, adduction, and internal rotation as we tighten up the lats. So the key here is that whatever we're doing to assess, we need to do it with the knees off the ground. So we're going to assess in supine. So Haley's going to bring her knees up to her chest, both knees, and then we're just going to start one at a time. If you have a painful shoulder, if you know you already have a stiff shoulder, you can start with that arm, but we're going to check each arm, both active and passive. So she's going to lift her arm up and overhead as much as possible. We want to see that elbow get in line with the ear, and we just want to see, is there any more room there for overpressure? We can assess side to side, so she can relax her left arm. Now try her right arm. Are we picking up symmetry? And now, because of the way that the lats insert on the thoracolumbar fascia, we know that bilateral overhead is different than single arm. So now I'm going to ask her to do both at once and see what shakes out. And so I would call that a... Now, if that wasn't, if we saw that we're missing 5, 10 of shoulder flexion overhead, we would follow up in the same position with the treatment. What does that look like? That looks like a PVC pipe and a change plate. The stiffer the shoulder, the heavier the weight. We already know that Haley has pretty good mobility here, so we're going to move, instead of a double pronated grip, to a double supinated palms up grip on this PVC pipe. And so she's going to grab somewhere between a press grip and a snatch grip. And the key here with this treatment is time under tension. I like to give out 5 sets of 5 reps where I'm going to cue her to take at least 3 seconds to lower that PVC pipe until it gets at least in line with her ear, if not maybe a little bit lower. And then she's going to bring that back up. We're going to go through that 5 sets of 5 reps. And again, the key here is that in the assessment position, the treatment position looks the same, right? Knees are up to the chest. We're pre-tensioning the lats, and we're actually creating some stiffness to move through with this treatment. What's great about this is a lot of people can get this done at home, and pretty much all of your gym-based athletes are going to be able to get this done in the gym. PVC pipes and change plates are in abundance in the gym. So that's how we assess for lat length, and that's how we treat lat length. Now, the next thing that's, again, often overlooked in the overhead athlete is subscap length. We've talked here on Fitness Athlete Friday. We've also addressed it on Clinical Tuesday with dry needling of getting after the subscap. Why? The action of the subscap is to bring the shoulder down and in, right? Shoulder adduction, shoulder internal rotation. What are we trying to do in the snatch and overhead squat? We're trying to abduct and externally rotate. This is often ignored. Lat is often treated first, which is okay. But with Haley, if you're not seeing anything that needs to be addressed, yet that person is limited overhead, the next thing on your hypothesis list should be the subscap. Clinically, when I see somebody with stiffness overhead, I'm usually going to treat the subscap and the lat at the same time with some needling and then get after these individual treatments. However, we're going to go right to the assessment. What is a good way to assess the subscap? Great question. In your PT school books, you probably found that it was tested at neutral, right? Can you bring your hand outside of your shoulder? What's the problem with this? The problem with this is that most people are going to be able to show you some pretty good external rotation with the shoulder in complete neutral. No flexion, no extension, no rotation, no abduction, no adduction, right? Nothing is on tension when my shoulder is at my side. It's literally hanging here. And so assessing here and treating here has very little value for the overhead athlete. Instead, we need to do what we like to call here in the fitness athlete division, the Weenus test, the slang for the skin on your elbow. And what does that mean? That means that I'm going to ask my patient to put their elbows together in the front rack position and externally rotate their shoulder. Can we get hands outside of the shoulder? She's doing a really good job here. If you want to see a bad job, check this out. That's all there is, right? Even unilaterally, right arm, okay, left arm, nothing. When I try to externally rotate that left arm, I feel like something is tearing inside of my armpit. So that is subscap. So how do we treat that? We assess it with the Weenus test. What we can do there is nice. We can take a goniometer, we can take an inclinometer on our phone and get that angle of external rotation, and then we can do some treatment. Treatment, again, for internal rotation often looks like stuff in neutral. It should resemble the front rack or the overhead position. So we're going to bring a foam roller. These extra long foam rollers are really nice. Haley's going to lay her thoracic spine across the foam roller. She's going to be up on the foam roller. This can take some balance challenge for some patients. And then our goal here is, again, we want to bring that elbow up into that adducted position. So she's going to bring her arm up. And then what I'm looking for is that we can get the hand below the level of the elbow. And what can provide some overpressure is a 5 or 10 pound change plate. Now, normally in the gym, someone would be on the floor and we'd be looking for their hand to touch the floor to know, we can see this angle here, that we're getting into some really good external rotation. Patients will often tell you they feel this in the anterior shoulder or, again, inside the armpit. That's how you know you're challenging subscap. Now, what if somebody has pretty good mobility like Haley, but they need some more range to work through? In the gym, we can just put 45-pound plates underneath the foam roller. We can increase the surface and increase the deficit that she's going to move her shoulder through. Dosing that out, I like to see people be able to do a couple sets, 20, 30, 45 seconds, get some really good time under tension. And then I like to follow that up with a more active position. So we're going to go over to the squat rack here. We'll move this table out of the way. And what I have set up here is I have a pretty stiff band, a blue rope band here. And what we're going to have Haley do is choke up on this band pretty good. She's going to lock her elbow in the other side of the upright. And so elbow is planted. She's letting that band pull her hand outside of her shoulder. Key here is that the trunk is as upright as possible. We don't see a lot of cheating with side bending. We don't see a lot of cheating with any sort of thoracic rotation. And her hand is getting outside of our shoulder. We can make this more active by asking her to try to bring her hand in towards her chest and do some contract relax. I really find, again, a couple sets, 20, 30, 45 seconds, really opens up both that front rack, but also that overhead position for the overhead squat and snatch. It really helps stretch out and lengthen that subscap muscle. So that's how we address lat length. That's how we address subscap length in the overhead athlete. Before we move on to thoracic rotation, I'll take a break, introduce myself. My name is Alan. I am an instructor here in the fitness athlete division. It is Fitness Athlete Friday. It's the best darn day of the week. We talk all things CrossFit, powerlifting, Olympic weightlifting, endurance athletics here on Fitness Athlete Friday. If you yourself or one of your patients, athletes, or clients is active on a recreational or competitive basis, the stuff we talk about on Fridays is for you. If you want to learn from us in the Fitness Athlete division, your next chance is going to be January 14th with Fitness Athlete Level 1 Online, our entry-level 8-week online guided course, or Fitness Athlete Level 2 starting January 20th. That is our advanced 8-week online course. We also have our Fitness Athlete Live seminar coming to a city near you in 2025, so check out ptinice.com for more details. We do have a price increase coming your way. Any course price $695 right now in 2024 will be jumping to $750 in 2025. So you can buy a course you see right now and get it for the current price. We also have the new option this year to buy a course credit and get a coupon code. If you see a course come your way that you like later on in 2025, you can use that coupon code to buy that course at the 2024 rate of $695. So let's finish with thoracic rotation. Why do we care about this? We get this question a lot in our live course and our level 1 online course. Why aren't we chasing extension? We don't chase extension too much because most people can show you an active extended thoracic spine. They may not be able to hold that position, which is not a question of mobility at that point, but in range strength. However, we care about rotation because extension and rotation are coupled, and we can't uncouple them in the thoracic spine, especially as we elevate the shoulder and the scapula upwardly rotates. We're naturally going to begin to command some extension out of our T-spine. And that means when we run out of extension, our thoracic spine is naturally going to start to rotate a little bit. And if it can't rotate, that is the end of the range of motion, not only for the thoracic spine, but for the arm continuing overhead, especially in this wide overhead squat or snatch position. If we don't have a lot of rotation, that's going to limit our in-range overhead range of motion. So if folks can get to extension, maybe they need some extension strength, but they can't show you any more motion. We need to assess thoracic rotation, and we need to address thoracic rotation with mobility and strengthening. So we're going to do that right now. How we like to do that is we like to assess in quadruped with a technique from SFMA, the quadruped lumbar lock test. So we're going to test both sides. Athlete's going to pick a side, put their hand between their legs, and then they're going to try to sit their butt back to their heels as much as they can. They're going to take the opposite hand that's not planted and put it in their low back. So I'm actually going to have her switch so that she will rotate towards me. And so now I want to see, what does active rotation look like and what does passive rotation look like with some overpressure for me. So ideally we've locked out the lumbar spine here and we're just seeing what thoracic rotation looks like. So I'm going to ask Haley to twist towards me and we're going to see what it looks like. We want to see at least 50 degrees here. I would say that's pretty darn good, but we're going to confirm, is there more hiding in there? I can see her. You probably can't see her. I can see her shaking terribly right now, which tells me some strengthening is warranted, but we'll get to that. So I'm going to come in. I'm going to block her hip as much as I can, grab that shoulder. Is there more motion hiding in there? Boy, is there. There's a lot more in there, right? So what does that tell me? Thoracic rotation in an athlete like Haley is okay, but it can be better. And it's not limited necessarily by true stiffness, but just her inability to access the range that she already possesses. What does that tell us? We just need to warm that up a bit, and then we need to do some in-range strengthening. That'll probably also clear up some of the shakiness at in-range rotation. So how do we do that? We like to do that with some heavy and light bands over attached to the squat post. So she's going to come over. I'm going to try to stay out of the way so you can see her. The first thing she's going to do is get into the really heavy green band. She's going to put her arm through and twist around like a backpack. She's going to get into that same lumbar locked position that we just did in the assessment. And now she's going to let that heavy band actively assist her into thoracic rotation. And already she's showing us more motion with the assistance of the band than she was able to show actively on the table. So maybe a minute or two here, just kind of warming up that rotation, getting to her true in-range, feeling where that in-range is at. And then if somebody can achieve that in-range after a little bit of either hands-on care or active care, we're going to reinforce that. So she's going to stay in the same position, but she's going to grab a much lighter band. So we have this orange band from Rogue that's just a couple pounds resistance. And now, same position, quadruped, lumbar locked, she's going to reach under what we like to call thread the needle and open up into thoracic rotation as much as she can. And now we can increase the length of the lever too. So as she comes out, she can try to extend the elbow and come up and overhead as much as she can with that band. And a lot of athletes, after even a couple of reps with a light band, are going to tell you that is lighting up their thoracic spine. It feels like muscular burning, maybe even starts to cramp a little bit, which tells us we're working on exactly what that athlete needs to work on. So that is 3 simple things to significantly improve the overhead mobility and strength in your athletes who need to do things like overhead squat and snatch. Addressing lat length, really paying attention that as we assess and we treat, we bring those knees up to the chest, we pre-tension the lats, and we ensure that we've ruled out lat length as a contributor to maybe some stiffness in the overhead squat or snatch. We address subscap, which is often unaddressed, by using the Weenus test to check in a really bound up shoulder position. Can the athlete access in-range external rotation? If not, we showed you two techniques, supine on the foam roller or the change plate, and a more active position with a band across the rig to do some contract relax. And then we addressed thoracic rotation, both assessing it, ensuring that the athlete is not truly stiff, but is rather not accessing the motion they already have, how to reinforce that with a heavy band, and then how to strengthen now throughout that range of motion with a lighter band. So we hope this was helpful. We hope you have a wonderful Friday, a wonderful Christmas and holiday season. We'll see you all next time. Bye, everybody.